The Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali-Pate, has stressed the urgent need for Nigeria and other African nations to take full ownership of malaria elimination efforts, warning that reliance on external financing alone will not yield lasting results. Speaking at the Big Push Against Malaria event in Abuja, the minister described malaria as an African problem that requires local solutions to tackle the burden of the disease. Our correspondent tells us more on this story.
According to the minister, Nigeria alone bears about 30% of its national disease burden from malaria and 1/3 of the global malaria burden. The minister said Nigeria must now customize its response to suit its political, social, and economic realities. Speaking at the Big Push Against Malaria event in Abuja, the minister announced progress in local production of diagnostic kits and bed nets, as well as pilot deployment of malaria vaccines in Bayelsa and Kebbi states, describing them as a step towards reducing dependency on imports and creating jobs locally.
But as Africans, I think we should leave the idea that it is someone else's problem. Malaria is our problem. And if we own that problem, then we have to first do what we need to do, and then we appreciate those who contribute to it, whether it's the UK, whether it's the US, whether it's the Global Fund and others. And with new tools, we participate in constructing those tools and approaches through research and development, through other innovations that may be coming down the pike to see how we really deal with this issue, which 90% of it is on our continent. Now, the vaccines have also come. We're piloting them in Bayelsa and Kebbi, but we're realizing that it's not as simple as that. That the uptake wasn't as rapid as we thought. It's also something that has to be laid on top of several other interventions, which we have to optimize. So there's no magic bullet, essentially, but we're wading our way through it.
Also speaking, the Minister of State for Health, Dr. Ishaq Salako, and the WHO country representative, Dr. Alex Grassa Sira, reaffirmed the importance of government leadership in combating malaria, especially amid the dwindling international financing.
It is critical to develop new, more effective approaches to combat and prevent the spread of resistance. Humanitarian crises, such as armed conflicts and natural disasters, are also contributing to the rising number of malaria cases. Displaced populations often lack access to healthcare and prevention and are particularly vulnerable. Addressing the root causes of this crisis and providing targeted support will be vital to stop the spread of malaria among these at-risk communities.
It is urgent that our commitment is translated into concrete actions that will mobilize resources, strengthen systems, and prioritize impact. WHO will continue to provide evidence-based guidance to support countries, adapt strategies, tailor and scale up interventions, facilitate the pre-qualification and introduction of novel, cost-effective products, as well as strengthen partnerships. Together, let us take bold action and save more lives.
The Chief Executive Officer of the RBM Partnership to End Malaria, Dr. Michael Adekulichas, emphasized collective responsibility, while Chairman of the House Committee on HIV, AIDS, Tuberculosis and Malaria Control, Amobi Godwin Oga, pledged legislative support for increased malaria funding.
The House Committee on ATM of the Nigerian Parliament is proposing a collective and holistic approach to solving public health threats in Africa. We cannot talk about malaria without talking about HIV/AIDS and tuberculosis. Therefore, the ATM Committee is proposing to African Parliament and government to establish a multi-sector-driven agency that will confront and combat the serious issues of AIDS, TB, and malaria in Africa. We in the Nigerian Parliament has concluded plans to amend the law establishing National Agency for Control of AIDS, NACA, to be the National Agency for Control of AIDS, Tuberculosis, and Malaria Control, NACATAM. This amendment bill will be read for the first time immediately the Parliament resumes from its vacation later this month.
Be it domestic financing, be it blended financing, be it integrative financing. And as we were in the holding room just before we walked in with the Honorable Minister, his very commitment and passion and drive is, yes, we can have all these strategies, we can have all these actions, but if there's no money, we will not get further. So the big push is really about how do we ensure that we have the money and the resources to make things better and to do things differently. Let's outsmart the mosquito. This is the time.
Experts said ending malaria requires sustained financing, innovation, and stronger collaboration. They expressed optimism that with Nigerians' renewed commitment, the country could outsmart the mosquito and set an example for the continent.